doing WRPB and WRPB studios. So sometimes I have more fun before I get on the air than when I get on the air. So we're running late because we just sit here laughing. With me is Kim and Kim, okay?
Mm-hmm.
And this Kim next to me is Dr. Kimberly
Mm-hmm.
from Pinnacle Foot and Ankle Center.
Yes.
And that's just Kim.
It's Kim. I don't have a last name.
Okay. And I would have found out more about her, but she was too busy excited in front of the camera and the lighting and stuff.
And her complexion. It's perfect.
Yeah. So this is, so, quiet lady.
Oh.
So this is like, you love this kind of stuff?
Uh-huh.
Really?
Yeah.
Why?
It's just fun.
Most people are like nervous in front of the
I was an
camera.
only child.
You haven't grown up yet?
Mm-mm.
Still waiting on
46,
that?
yes. Yes.
Okay.
I love it. I love it. I'm so excited.
Not even a
So
little
excited to
bit.
be here.
All right, Kim,
Yes.
Dr. Kim,
Yes.
why'd you get into this industry?
Good question. Nobody else wanted to. And if you want my stock answer is it's better than proctology.
Yes. And
Um,
I use that. You can't be a brain surgeon and a proctologist. Pick what you're really good at.
Correct.
Stick to it.
Yes. But honestly, I was a physiology major, and my professor came up to me one day, and she was like, well, did you ever think about doing podiatry? And I said, ooh, feet. No, not really. And she said, but it affects, if your feet hurt, it affects every aspect of your body. Plus, you can do surgery. We diagnose cancer. It's not just, nails and all that. So she's the one that kind of turned me onto it.
You know, when I was a kid, I had inverted toenails
Mm-hmm.
on both big toes. And my parents would take me to the doctor, and they'd cut them. And every time you cut them, it got worse.
Mm-hmm.
Because they just grew over one another, and I was always in pain. And more than the pain, I was a kid, so I was wearing sneakers with that toe piece cut out. So thank God I never got bullied. But,
Ingenious.
but finally, they took me to a doctor that cut the toes and took out stuff. But
Permanently.
I still have one toenail that grows on the corner over the other one.
Well, come make an appointment.
Well, I'm just saying. Okay.
I'm sure there's no toe cut out in there.
No.
Okay.
I called you a million times to come in. So your appointment here was as good as my appointment there.
Stage fright.
Okay.
That's why we bring her.
So now, are you working in her office now?
I do marketing, pretty
Okay.
much. Yes.
So you get into this, how long are you in the industry?
About 11 years now.
Okay. So you kind of like touched on, but why podiatry?
So for
And
me,
I know it's better than proctology, but
it
why?
is. It
Maybe.
is much better than proctology. But it's very few and far between that you can be in an industry where you do something in the office and immediately the pain is relieved. For me, that's like super gratifying. So I'll have patients come in, they're hobbling. I'll do something very simple, and they're praising me afterwards, saying I can walk again. So for me, that's huge.
So you do surgery too.
I do.
So, because this is not my industry, well, I mentioned what happened with me, but what kind of surgery do you do?
So I do everything from, like you were saying, ingrown nails, that's done in the office, to ankle fractures with hardware, screws and plates, anything below the
wow.
knee.
Okay. So who's your clientele?
A lot of podiatrists have a niche, right? So we see everything. As a matter of fact, I think I was told I was the only one seeing pediatric patients. So I'll see anybody from 0 to 100.
Zero's a bummer to get in there. I worked on those.
It always breaks my heart when it's the little guys,
Oh.
but I'm also doing a lot of wound care. I'm actually working at the wound care center now too.
Okay, wound care on the feet
Yes.
and ankle.
Mhm.
What do you see most? Like, patients come in, we get that. What's the biggest problem that you
The
see?
biggest, of course, is plantar fasciitis. They say that's probably 80% of the population will deal with it at some point.
Any idea? Is it just me that doesn't know?
No.
So yeah, let me talk. Heel pain, bottom of the foot pain. So
Okay.
that's when the ligament on the bottom of your foot becomes inflamed. And since we walk on it every single day, it's very easy for it to become inflamed.
I would have thought it would be bunions and stuff.
Believe it or not, no.
Really?
hmm
Now,
It's because South Florida, everyone wears flip-flops. So
what I found interesting and a lesson learned is my mom, I took care of my mom for 4 years till she passed. But when she'd have a UTI, she'd go in the hospital and then they put her in rehab.
Mhm.
Well, she got a wound on her heel, like this big.
Mm-hmm.
And correct me if I'm wrong, but an elderly person that gets a wound on their heel will almost never heal.
Correct.
So it made her someone who was partially mobile to not mobile at all.
Mm-hmm.
And that was the beginning of the end for my mom. Is there any, I mean, so she was 90.
Mm-hmm.
Can a wound on a heel like that, can you fix that? Can it heal?
Absolutely. We've well,
It was too late because my mom passed away.
Well, should have brought her to me. But yes, we heal a lot of those. You have to do rigorous debridements. Sometimes we have to put a graft on there, and you definitely have to offload. So there's special boots, especially those patients that are older
Mhm.
and laying bed all the time. You have to alleviate that pressure because that's what causes those wounds.
And debridement is
What I did to you.
cleaning out the
Yes,
wound.
you have to clean the wound of all the bacteria in there.
But you have to do that quite often.
Usually we do it weekly.
I know that it was so much pain for my mom, and we believe that the infection
Mm-hmm.
got into the bone,
Mm-hmm.
okay, because it wasn't probably treated properly. Is that why an infection would go into the bone?
Absolutely. And even then, though, there's some you can be put on IV antibiotics. Typically, it's for 6 weeks, but that usually will resolve the bone infection.
Yeah, it was a very tough scenario. Seeing your mom in pain is horrible. And she had the beginning of dementia.
Mm-hmm.
And she was 90. She was ready to go, I think, from being mobile to not being mobile. But she had no filter, so I learned that from her.
Woman after my own heart.
Okay, so I learned that from her. All right, so people now call doctors, and there's 3 weeks before they can get in.
Not at our practice. So
Okay.
we have a strict policy. All my staff members know any new patient will be seen within 48 hours, regardless.
Okay, so it's you. Any other doctors in your office?
No, it's just me currently. We have a great medical assistant, an awesome receptionist, and of course,
And a
my lovely
marketing
marketing person
Kim,
right here.
known as Kim on.
So
streets.
now I
Kim.
know.
One word.
Let me tell you
Kim.
what I learned. I learned that if I don't have somebody like to come in and sit with other people, I just call Kim.
I mean, that's it.
Kim, look,
That's all you need to do.
I have
One
a,
word,
I have,
Kim.
I have a bagel lady coming in to talk about her bagel. So you want to come in and sit with
Oh,
her?
she will. She'll come.
Okay. But, we talk about life being short, and you really have to enjoy it.
Yes.
And sometimes you have to come out of your comfort zone. Okay, so you're like, oh my God, I had stage fright. But do you think it's any better for, like, me coming to a doctor?
No. Yeah, definitely. A lot of people have
We
that
have stage fright.
white coat syndrome. But
Yeah.
it's funny because when I walk in with all my 5-foot self, they look at me and they're like, "What are you, 12? You're going to be my doctor?" I'm like, "Yeah, it breaks the ice."
I'm closer to you. I'm closer to your feet.
Yeah, exactly.
Okay.
I'm down there. I'm at that level.
Right. I get it. But what's interesting is that we were talking prior, and the laughing and the joking makes the treatment that much easier, that much better.
100%. Like if you look at our reviews, of course the ones we're most proud of is it's like family. We don't. It's not stuffy. It's not that typical white coat, very industrial. You walk in there and you feel like a number. We try to make everybody family there.
Do you get a lollipop when you leave?
Hmm?
Do you get a lollipop when you leave?
Chocolate,
Oh.
which is great for my diabetic.
Or you can color a picture. That's how I met
yes.
Doc.
Really?
I was a patient, and I had a ganglion cyst on my foot, and not to be gross, but you would drain it. And drain it.
That's
and kept-
gross.
Yeah, and it kept back. I went like 9-10 times. She's like, we might have to do surgery. I'm like, no, it's just so much fun in her office. It's so much fun. And then eventually she did surgery, but it was the office.
Because you were drawing pictures?
I have one. It says Kim B's are age 43.
It's on my wall.
It's on the wall. But I'm
like my daughter's pictures on my refrigerator?
Yes.
Really?
Yeah.
You'll see when you come in behind my desk. I have a bunch of, well, not just children.
Yeah, adults
The
too.
color
I
feed for
couldn't
me.
believe she was a real doctor. I'm like, how are you so kind and caring, and you follow up, and you call me and ask me how I'm doing, and you can't be a real person.
And it's amazing because you guys became good friends.
We
We're
did.
buddies.
Yes.
So that was kind of cool.
Mhm.
All right. I hate to put you on the spot,
All right, hit me
but I
with it.
have to.
Let's do it.
Who's more difficult, men or women?
That's easy. It's definitely men. Simply because like I was saying, you can get a big burly man, 250 pounds with lots of muscle, arm sleeve tattoos, and you pull out a needle, and he's like, I don't like needles. And my favorite response is, you do understand how all of that got there, right? So it mostly because the scare factor with men.
Okay, so added to that, who follows up and listens to you better?
Honestly, probably the children.
Because their parents make them.
Well, yeah, absolutely.
But I mean, I'm sure that, I could be wrong, I'm sure that someone doesn't come in and you work on them and then you don't ever see them again the rest of your life. I'm sure they either take antibiotics or some sort of medicine.
Yeah, we always have a follow-up. It's just, Dr. Google sometimes supersedes me. That's who I fight against most these days.
Taking care of a problem like that is not a DIY project. I say that all the time.
Mm-hmm.
Okay?
But I see it every day.
Do you?
Yes.
And I can't imagine. So have people come in with the weirdest bandages that you could possibly imagine?
Do you want to hear the weirdest?
Yes.
Okay, so I had a gentleman. He had a very large diabetic wound with a lot of drainage, and I said, you know what, you got to keep this bandaged every day. Make sure it stays clean. The next time I saw him, he walked in with a maxi pad taped to his foot and said, "Well, doc, it absorbs blood." And I went, "Well, I can't really argue with that, can I?" True story.
But it's interesting because everybody has an answer. Don't confuse them with the facts. They already have their mind made up.
Correct.
Okay?
Yes.
It is really that. So, Kim,
Yeah.
what do you do? What do you do in the office?
Marketing online, Facebook, but mostly, believe it or not, I'm very introverted. It's word of mouth. I mean, it's word of mouth. I literally, I don't even have to sell her. I'm the biggest fan of her.
What I love about it is she had a personal experience with me.
Right.
And she went out there and did that all on her own. And when I kept getting patients that said, you know that Beezer, do you know her? I'm like, yes, of course I know her. So I'm like, well, shoot, I should just hire her then.
And to touch on the topic of not listening, after I had surgery, I had to wear a boot. So the next day, I'm like, I'm not wearing this boot. This is embarrassing. Put my flip-flops on.
She did.
I call her and I said, Doc, my foot is bleeding profusely. What do I do? She says, is it in your boot? I said, I don't wear that. You told me 4 weeks of that boot. I'm not wearing that thing. Didn't listen. And then it got bad.
Well, thank you, because now you answered the question that I asked her.
No.
Who listens more?
I didn't listen. She said, this big boot. I'm like, I'm not wearing
She's
that.
the odd one out.
I'm like, I'm not wearing that. And then she got highly infected. It was really bad. You play it down, but it was very bad. And she saved my foot, basically. You did give yourself props for that.
Well, thank you.
Yes.
So
Amazing.
obviously, men listen better than most women.
Yes.
Or everybody
Why
listens.
don't we say that's person
Everybody,
dependent?
everybody listens better than
Except
Kim.
Beezer.
Yes.
Everybody
Now
listens
we
better
can
than Kim. She didn't put on a boot because she wanted to come back so she could draw some
Well,
more.
she loves those flip-flops.
Yes.
Yeah,
Yes.
and I got more pictures from her, yes.
Did you?
I did.
Well, now it's bad because she works with you.
I know.
So now she has access to the crayons.
Correct.
Okay.
That is absolutely
What
true.
ages do you work with?
Funny.
So honestly, newborns all the way up to 100. We don't
Wow.
discriminate. We see all in between. We've seen athletes. We see those weekend warriors. We
Police
see everybody.
officers.
A lot
of police officers.
Oh, because they're on their feet?
Mhm.
Giving tickets?
Yeah, lots of them.
So, if you were going to do this again, would you go into the same field?
Yes, I would. But probably not for it. One, like I said, the gratification. But two, I honestly feel that a lot of doctors have lost the real meaning behind what they do.
Oh, without a doubt.
It's become a money grab, and you're kind of a number, and I don't like that. So I think we need more people that see people as, family.
Because I'm older than dirt, I'm on Medicare with a supplement, so I can go anywhere I want.
Amen. 100%.
Yeah, so I was looking I wasn't going to get a primary, but because I had 2 strokes and 2 different doctors, and I had my first stroke down in the Cleveland Clinic area, my second stroke I went to Longwood, which is HCA, and this medicine, and this one prescribing this, and I said, let me get a primary to control all my medicine. But it's a nightmare to find a primary.
I know.
But I found, by accident, a primary that took me in 6 days,
Nice.
which is rare.
Yes.
1-man operation, and he spends 20 minutes with you.
Isn't it great?
Right. So I always joked when the first time I went to him when I came out, I said, I met this doctor. He's really, really good. He had this weird thing. It's like a piece of stick, and he stuck it in my mouth, and it made me feel every tongue. And then he looked at my ears. Well, doctors do that? Because those days are over.
Mm-hmm. Oh, I know.
Normally on the computer, they
Right.
just look.
That's
Yes.
all. Okay.
Yep.
So my last visit with him, he yelled at me that you need to lose 20 pounds. And he said, I'm not asking you, I'm telling you. Okay? And he's
Tough
just.
love.
And I found him by accident because my neurologist is in that building.
Right.
The MRI place is in that building. And he's in that building. So I went to the neurologist that day, and I stopped at the MRI place to make my appointment.
Wow.
And I said, you know what, let me just go across and see if he can see me. And they were great.
That's awesome.
Great doctor. It's a pain because I'm a bad patient. I'm not a...
You're stubborn?
No. I'm a bad patient because he'll make a follow-up appointment, and then I'll reschedule it, and reschedule it, and reschedule it
Oh, like this one.
a million times.
Mm.
Because, okay, only because I didn't want to go for blood work. Because I hate taking
Needles?
blood. No, I don't mind needles. I don't like the blood taking.
Okay.
Because I'm a hard stick.
Okay.
And plus, you have to wait 4.5 hours at Quest to get your blood.
Mm-hmm.
And I always leave there with black and blue arms. So I found another phlebotomist that I walk in. I don't have to make an appointment. I just go in,
Nice.
does my blood,
Great.
okay, and never does it bother me. Never does it. He finds the vein almost immediately.
Nice.
Mhm.
Best phlebotomist I've ever met.
See, we need more people in medical that do those kind of things.
Mhm.
That's
do
how I
them
feel.
properly.
Correct.
Okay. I call your office to make an appointment. You're going to see me within 48 hours.
Correct.
What? Because with this in the world of technology, which excited her here, but over and above that, can I, fill out whatever I need to fill out online before I get there?
So, yes, we have not started the whole online completely with the portal, but you can. We have a link to where you can print out the paperwork at home and fill it out
Okay.
and bring it with you.
So I say that I avoid going to doctors. Well, the reason I'm not scared of going to doctors, I just hate filling out the paperwork.
The novel, yeah.
Yeah, it's ridiculous. And then, so that's the bad part. And the next bad part is when they don't put in the insurance properly and they bill me. And I have to fix that problem myself.
Mm-hmm.
I pay all this money for a supplement, and then all of a sudden I get a bill.
No, we totally agree with that. So there's a lot of that with the secondary where claims don't cross over, but we have an awesome off-site biller that does all that for you. So
Very
we
cool.
don't have our patients fighting claims.
All right. Do you have a website?
We do.
Which is?
PinnacleFootCenters.com.
And a phone number where people can reach you?
Mm-hmm. 772-742-7118.
And that's where they can book an appointment?
Mm-hmm.
Where are you located?
We are right next to St. Lucie Medical Center off of Hillmore.
Everybody, she said something that was interesting about using a Google doctor, okay? And I say it a million times, it's not a DIY project, okay? And if you're not going to use a professional, it's going to cost you 5 times more in money in the long run and 10 times more in frustration, and in this case, maybe affect your health greatly. Kimmy,
All the
Kimberly,
above. Kim Squared.
Kimberly something.
Squared.
It was great having you guys on. Everybody,
Same.
use
Thank
a
you for having
professional.
us.
We'll be right back.